At Baptist Health South Florida, we understand that your need for care doesn't end when you leave the hospital, whether your stay with us was for a planned surgery or unexpected surgery. As part of our commitment to patient and family-centered care, we're here to help you and your family plan for the next steps in your recovery. The Discharge planning team will coordinate your transition out of the hospital. Exactly what that means depends on your needs and desires. Recovery at home is one option, or it may be recommended that you continue to heal and gain strength in a healthcare facility. What is the best option for you? Start by answering these questions. What treatment or care will I need? What will I need help with? Am I able to care for myself? Will family and friends be available to help me? Will I need any medical equipment? Am I able to obtain my medicine? Do I need transportation? What will my insurance pay for? Many patients have the option of recovering and receiving additional treatment at home. In order to be discharged home, you should be able to take your medicine, manage your basic needs such as eating, bathing, and grooming, and be able to go to your doctor's appointments, even if you need assistance to do these tasks. If your condition keeps you from leaving home without help, such as a wheelchair or walker or special transportation, you may qualify for home health care. The goal of home health care is to provide treatment for an illness or injury so you can get better, regain your independence, and become as self-sufficient as possible. Home health care may include intermittent skilled nursing care for giving intravenous drugs, injections, tube feedings, or other nursing services, as well as rehabilitation therapy. If your recovery calls for a level of care that just is not possible at home, your discharge planning team may recommend you transfer to another care facility. There are several types of care facilities based on the services you will need. A social worker can help you choose which facility would meet your needs best. If you've had a procedure such as a hip replacement or had an unexpected medical event such as a stroke, a social worker may recommend therapy at an inpatient rehabilitation facility. Inpatient rehabilitation units are for patients who require intensive short-term rehabilitation care. If you're not strong enough to tolerate 3 to 4 hours of therapy a day, another type of facility may better meet your needs. A skilled nursing facility, also known as an extended care facility, may be appropriate for you if your health problems are too severe or complicated for care at home, and you're not able to tolerate the requirements of inpatient rehabilitation. Skilled nursing care involves trained professionals performing services that are needed temporarily due to an injury or illness. Your length of stay depends on your healthcare needs and how your recovery is progressing. Assisted living, also called residential care, can be a good option for those who can no longer care for themselves but would like to remain as independent as possible. Assisted living facilities do not provide nursing care, but a home health care nurse can visit you there. To live in an assisted living facility, you must be able to get out of bed with assistance and not have any conditions that require 24-hour nursing care or wounds that need complex care. Residents in assisted living enjoy the independence of living on their own in a residential setting while being provided with personal care services such as meals, housekeeping, transportation, and assistance with activities of daily living. A nursing home provides long-term nursing care and non-medical care known as custodial care that helps with activities of daily living such as providing room and board, preparation of special diets, and personal care. A nursing home is an option for those needing help with things like getting out of bed, taking medications, using the restroom, or feeding and bathing themselves. Residents of nursing homes usually live in these facilities on a long-term basis. You probably have many questions about what your health insurance will pay for. Different kinds of insurance policies can offer very different kinds of benefits and can limit your access to some providers. The best way to find out what your insurance company will pay for is to call them. The customer service phone number is listed on the back of your insurance card. It's important to find out what costs they will pay for and what expenses you will be responsible for. If you need further help finding out what care your insurance will pay for, your social worker can help you. Here are a few things you should do before you are discharged. Ask your nurse or doctor questions if you need more information about your medical condition or care. Make follow-up doctor's appointments. Fill your prescriptions and understand when and how to take your medications. Talk about your transportation needs and make arrangements with family and friends who can assist you.
Ask to speak to a social worker if you feel you need additional information about resources.
Your nurse will go over all of your discharge instructions with you and your family. The instructions will be added to your admission discharge folder. Be sure to take this folder with you to any follow-up medical appointments you may have. On behalf of the Baptist Health South Florida family, it's been a pleasure to care for you. Thank you for letting us serve you.